Maintaining hand hygiene by washing hands or using hand rub is extremely important and effective to prevent the spread of the infectious diseases including COVID-19 virus, common colds, flu, diarrhea, and pneumonia, so reducing the general burden of disease. If your hands are visibly dirty, then it is important to wash your hands with soap and water, and the correct technique can be found in this short video. Otherwise, hand rub can be used. Rubbing or washing for at least 20 seconds is needed to be effective. Here is a simple step-by-step guide for the production of 10-liter preparation of hand rub for local use as recommended by the World Health Organization.
You will need 4 basic ingredients. Ethanol 96%, 8,333 ml, or isopropyl 99.8%, 7,515 ml. Hydrogen peroxide 3%, 417 ml. Glycerol 98%, 145 ml. Water, either sterile or boiled and then cooled water, with the following materials. Large containers to mix ingredients. This can be 10-liter glass or plastic bottles with screw-threaded stoppers, or 50-liter plastic tank, or stainless steel tanks with a capacity of 80 to 100 liters. Wooden, plastic or metal paddles for mixing. Measuring cylinders and measuring jugs. Plastic or metal funnel. 100 ml plastic bottles with leak-proof tops. 500 ml glass or plastic bottles with screw tops. An alcohol meter. The method: measure all the ingredients. Pour the alcohol into the large container. If you are going to be using the same alcohol types and containers for production, you could mark the container with the level of alcohol volume needed for ease of measuring. Pour in the hydrogen peroxide from the measuring cylinder. Add the glycerol from the measuring cylinder. Remember, glycerol is very viscous and sticks to the walls of the measuring cylinder. It should therefore be rinsed with some sterile distilled or cold boiled water and then emptied into the large container. Top up the container to the 10 liters using sterile distilled or cold boiled water. If using 10-liter bottles, you may want to mark 10 liters on the container for ease of measuring. To prevent evaporation, quickly place the lid or the screw cap onto the container. Mix the solution by gently shaking. In making in larger containers, a paddle can be used before closing the lid depending on the container size. Take a sample of the hand rub and using the alcohol meter, measure the alcohol concentration of the final used solution. The accepted limits should be fixed to plus or minus 5% of the target concentration of 75 to 85% for ethanol. Once mixed and happy with the concentration, divide up the solution into its final containers. For example, 500 or 100 ml plastic bottles, and place them in quarantine for 72 hours before use. This would allow time for any spores present in the alcohol or in the bottles to be destroyed. Label the final product with details including the following: name of institution, WHO recommended hand rub formulation, for external use only, avoid contact with eyes, keep out of reach of children, date of production and batch number. Use: apply a palmful of alcohol-based hand rub and cover all surfaces of the hand. Rub hands gently for 20 seconds until dry. Composition: ethanol or isopropanol, glycerol and hydrogen peroxide. Flammable: keep away from flame and heat. It's that simple. Remember, production and storage facilities should ideally be air-conditioned or cool rooms. No naked flames or smoking should be permitted in these areas. WHO recommended hand rub formulations should not be produced in quantities exceeding 50 liters locally or in central pharmacies lacking specialized air conditioning and ventilation. Undiluted ethanol is highly flammable and may ignite at temperatures as low as 10 degrees Celsius. Thus, production facilities should directly dilute it to the above-mentioned concentration. The flash point of ethanol 80% volume by volume and of isopropyl alcohol 75% volume by volume are 17.5 degrees Celsius and 19 degrees Celsius respectively. National safety guidelines and local legal requirements must be adhered to the storage of ingredients in a final product. Don't forget, hand hygiene is a key way to prevent the spread of infectious diseases and keeping our patients and health workers safe. To see experiences of Zambian pharmacists producing hand rub and nurses using it in hospitals, please go to the extended version of this video.
We hope you have found this short animation valuable and are able to implement as needed. You can now hear firsthand the practicalities and challenges associated with the manufacture of alcohol hand rub and infection prevention and control. We've produced 3 videos with an infection prevention and control lead nurse and production pharmacist in Lusaka and Ndola hospitals in Zambia.
Part of the Brighton-Lusaka Partnership and an extended project from the Commonwealth Partnerships for Antimicrobial Stewardship. Collaboration and shared learning across 3 continents using digital technology. If you have any questions, do contact us at admin@commonwealthpharmacy.org.
Beatrice Carton from Ndola Teaching Hospital, an infection prevention lead nurse. My role is to ensure that infections are prevented in the hospital by ensuring that all measures are implemented. Infection prevention is basically the activities preventing the transmission of microorganisms. Also to control. If there's an outbreak of an infection, then you implement some measures that will help you to control the spread of infections. It is important because it prevents nosocomial infections or healthcare associated infections.
So technically what you are telling us that infection prevention is a multidisciplinary program, isn't it?
Yes.
How have you been able to coordinate within different disciplines?
Okay, we have 2 committees.
Okay.
As an institution, we have 1 committee for focal point person where we draw the members from each department.
Okay.
Then we have heads of departments. We have an infection prevention tool where we check for waste management. We look at the type of bin liners, if they are put in the correct place and in the correct bin.
Okay.
Then it also has the hand hygiene where when we go in a clinical area, we observe whether the members of staff or healthcare workers are practicing good hand hygiene.
Okay.
Then also we pick 1 member of staff to demonstrate the hand hygiene techniques. Yes.
Okay. In terms of?
In terms of hand hygiene, then also availability of hand washing, soap, also the alcohol hand rub.
Okay.
Not much.
Okay.
Not much challenges.
Okay.
Though when people are aware that the infection prevention team are coming to audit us, they ensure that everything is put in place.
Okay.
But most of the time, when we are conducting that audit round, we don't really inform the department,
okay.
But we inform the heads of department. But when the head of department leaks it,
okay.
They inform their subordinates. Okay. Financial support. Okay. We have an allocation in our hospital budget. It has been factored in, so we receive a certain amount of money to procure the IPC commodities and other logistics.
Okay.
Then we also, when we want to implement something, we involve also management to help us to implement whatever we want to implement.
Okay.
Also
okay.
on trainings, they also support us
okay.
on training of members of staff.
Okay. No, thank you very much. I think that's where we end this interview.
Okay.
Yeah.
Thank you very much.
My name is Ashiru-Oredope. I'm a senior pharmacist at Ndola Teaching Hospital, and I'm in charge of the production unit. We focus mostly on two things. One is the alcohol-based hand rub, also a surgical skin scrub that we produce for the theatres. Yes. Well, in 2013, through the African Partnership for Patient Safety, we were partnered with Guy's and St. Thomas. And through that, we were introduced to WHO in 2013. That did a training. So we had two of us who were trained in Zambia, two pharmacists, myself and one other pharmacist, to produce alcohol-based hand rub. So the purpose was to empower low-income countries to be able to produce hand rub in-house. So WHO calls it in-house production using their formula. Basically, our role does not end here. We hope we'll be able to reach other facilities to be able to train them so that they can start producing hand rub.
Okay.
So one of the biggest challenges is rising price in commodities that we use, raw materials. Yes, we've been seeing a drastic rise of commodities, and basically it means that the production cost goes up. Okay, well, sustainability first starts with management. So management at our hospital has been very helpful in terms that they have allocated us a fixed budget within the finances of the hospital monthly that we are able to utilize to procure the raw materials and any other things that we need. The other thing is also acceptability. The facility and the staff within the facility have been able to accept the hand rub that we produce and have been able to use and demand for it when it's not available. So that has kept us going. We have specific equipment, and bear in mind the WHO formula that we use is a simple formula that has been given to us, which we can use to produce it using very bare minimum requirements in terms of equipment. And most of the equipment that are needed are just glasswares, packaging materials, and a little bit of paper for labeling and all that. So it's not sophisticated equipment that is needed for production, but basic equipment within the reach of these facilities. So the cost of the materials and the equipment is quite minimal. Management asked me to provide a budget of what we needed to kickstart the production. Maintenance is easy because certain equipments do not get broken down very easily. Others are much of packaging material which we just disinfect and repackage. So majority of the packaging material that we use are reusable. So we wash them and then we disinfect them and repackage once and for all. The production process does not require much of staffing. It can be done by one person mostly. One thing I can say is the patent for the formula that we use is WHO. WHO has given us a blessing to use their formula and produce for in-house, bearing in mind that there are certain requirements within each country that are supposed to be met. For example, the fire safety of where you are working from. So even in hospitals, there are certain legal requirements that each institution need to put in place. Basically, according to WHO, it's been given to us to use in-house and not really as in a commercial part, but they have allowed hospitals to remanufacture using their formula and basically help patients and staff in infection prevention within the hospitals where it's being produced.
Okay. Thank you very much.
Thank you very much.
Very much. Actually, this initiative is helping us in the current situation of the outbreak of COVID-19. We are able to have our hand sanitizer. Hand hygiene is one of the preventive measures for COVID-19. So we are happy that we are able to produce hand sanitizer within our hospital, and we are able to meet the demand of the hospital.
So we have adopted the WHO standard for preparing a hand sanitizer, and we use 4 main ingredients, the ones that are displayed. So we use ethanol, distilled water, glycerol, and hydrogen peroxide. So this is the formula that we've adopted in preparing 10 liters of hand rub. So we use 8163 ml of ethanol, that is 98% ethanol, 417 ml of the 3% hydrogen peroxide, 145 ml of glycerol, 98%, and 1,205 ml of distilled water. The apparatus that we use, first of all, before we begin our preparation, we quality analyze the ingredients that we have. The 2 main ingredients that we analyze are the hydrogen peroxide and the ethanol. So to analyze the ethanol, we simply use the alcohometer. Okay? So we use this to test for the ethanol. It goes together with the thermometer. Then to analyze the hydrogen peroxide, we have to use the titration method. So we react the peroxide with the potassium permanganate and sulfuric acid. We do a titration process using the equipment that you're able to see. So it helps us to determine the molarity of the peroxide. That's what we use as the percentage of the peroxide. And depending on the percentage that we find, we titrate it to 3%. When we get 3%, that's what we use in the preparation of our hand rub. That's when we obtain the 417 ml that you're able to see.
How are they mixed? Is it in any kind of order?
Correct. So we have deliberately prepared this sheet for everyone to easily prepare at the same time. Okay. So the first ingredient that we use is ethanol. Then we add the peroxide, then the glycerol and distilled water in that order.
And mix.
And then mix.
Okay.
Yes.
Okay. So after mixing, how do we ensure that it's a quality product that has been produced?
Again, our major ingredient in the preparation is the ethanol. So in the final preparation, we need to test for the percentage of ethanol. We don't necessarily have to test for the percentage of the peroxide, because once we prepare our hand rub, it will be ready within 72 hours, and by then we assume the peroxide would have reacted, it would have formed water. So we don't necessarily have to test for the peroxide. It's just important to test it once we begin the preparation, but afterwards it's not important. So we just use the alcohometer to test for the final concentration of our ethanol. It should be, as we have put on the label, it should be 80%.
Thank you very much for your time, Mr. Bhatti, and for educating us.
Most welcome.
Thank you.